uh, and enjoying some deeper conversations than perhaps you've had time for in the past. But um, it's also that support, and knowing that you're not alone in this world. Even if you might be at home alone, um, you know make sure to be intentional, and if you need help, don't be you know don't be shy about asking. I know that some of my patients, especially elderly patients, sometimes I think that you know I think sometimes their visits are just as much social as they are medical. We have some great conversations, and I feel like I get to know them as friends as well. So that's been really, really helpful. Um, I'm going to turn it over to Dr. Tanya, and maybe we can go to the screen share again. We'll go with that. And we'll let her talk a little bit about supplements and whatever else she would like to do or like to share about what she considers the foundation of healthy lifestyle, and some supplements as well.
Yeah, I just have to echo the sleep piece, right? That is one of the things that I don't care if you're not sleeping, we got to talk about it, right? Make an appointment with Dr. Sue, make an appointment with me. Like, we got to talk about your sleep, because if you're not repairing, you're not resting, your memory is going to be bad, you're going to be grumpy, and it just is all downhill from there. So we got to get you sleeping. But foundationally, we also think, outside of diet, we know that we're not getting all of our nutrients from our food choices every day. I don't know about you, but 9 to 11 servings of fruits and veggies a day, like, just might not be happening, right?
Mm-hmm.
I don't care how much broccoli you love, like, you're going to get sick of it and we're going to have to do something else. So supplementation wise, I love to talk about, sometimes we call them the Fab Five or the Sexy Six, or, how many ever pills you can tolerate. I have a pretty low pill
Yeah, for
tolerance.
the Sexy Six.
And so my pill tolerance is pretty low. If you're a patient of mine, you know that I really try to get you off of things that aren't necessary. But there are some things we're not getting. One of my main, kind of favorites is fatty fish. And a lot of my patients really only will eat walleye and cod. Well, those aren't fatty and those don't count. You can go ahead and eat them, but they're just not going to count in our quota. So fish oil is one of those really great things. And it's also really important that you know where you get it. So here at Catalyst, we do use physician grade lab tested supplementation. So you know that it's not going to be sitting outside in the sun in Mexico for 5 years before you get it. It's not going to smell like rotten fish, which is gross. And it's going to do something, okay? So we can test lab values and make sure that you're actually absorbing it and utilizing it. So fish oil, hugely important for brain, memory, joints, inflammation in general. The other thing is, we live in North Dakota. It's cold for 12 months out of the year, and we don't get enough sun, right? So vitamin D is really, really crucial. Right now, hopefully you're getting outside. Until Dr. Sue and I were joking earlier, I said, it's going to snow this weekend, so you won't be able to be outside. But you need to get your vitamin D. So let's get your lab values tested. We need to have an optimal value for not only our hormone production, but also our immune function. So kind of hormone vitamin D is a double whammy. And, those are kind of my two fat solubles that I really love. The other one that I really like, I think we all need, is a multivitamin, multi-mineral. Like I said, you're not getting the fruits and veggies you probably think you are. And if you are, kudos to you. But I know it's hard to get those in every single day. So it's just really helpful kind of foundational support. So those three. The other thing is we know that life is a little bit stressful, right? Whether it's COVID, whether it's a wedding or something going on in your life, we want to support your adrenal glands, because those adrenal glands also make hormones. They also help you respond to stress, and they also help you have good memory and also have word recall, right? So if you can't remember what you're saying in the middle of a sentence, we know that you're a little bit stressed. B vitamins are really, really good at that, and they help us support those adrenal glands, but they also help us with some energy production. So if you're feeling kind of down in the dumps, maybe not so motivated, a B vitamin complex would be really wonderful for you. So now we're at 4. Are we at 4? Yeah, we're at 4. So if we added a fifth one, my favorite is, and the next is the probiotic. So right now, especially, we're doing a really good job of keeping everything kind of spick and span clean, right? And those gut bugs really need some support, and that might be through a probiotic. Also, we can think about functional foods like sauerkraut on your brats that you're grilling outside. Maybe you put them on your hamburgers. Maybe you have kombucha. If anybody's familiar with kimchi, it's kind of the Asian version of sauerkraut. The other one I really like is beet kvass. That's like a juiced beet that's fermented, and then also kefir if you're not sensitive to dairy. So all of those things are ways to kind of get in extra probiotics. Yogurt isn't my favorite, mostly because it's usually chock full of sugar, right? If you want to make your own yogurt, because you have so much time right now, go for it. But I think that adding some of those other things in is maybe more beneficial. And those are kind of the 5 things that I say, hey, let's just start on these. And you might feel worlds different just by starting on those kind of 5 simple things. And, you know, if you don't want to do supplementation, then let's talk about how we can help you get those things in through food, right? Because as Dr. Sue said, food is medicine. And, you know, it's something that I think both her and I really kind of core is food is medicine. Let's use it to our advantage because it's right here. We eat it 3 times a day.
Yep. So what's number 6 for sexy 6?
I have like 7 of them that could be sexy 6.
Okay, go for it. Sexy 7.
I think the next one that's really the most important kind of on our list, right, is to think about a sleep aid or an adrenal aid. And the reason why, you know, I add the sexy 6 is because this one is really focused on our adrenal glands. And so this is actually an herbal product that would help you balance stress and help your body deal with stress every day. Because if you're super stressed, there comes weight gain, there comes moodiness, there comes brain fog, there comes word finding issues, all of the things that I often see my patients for. So I really like a really good adrenal support as that kind of 6th product there so that we can just be even keel and handle some of those life stressors a little bit easier.
Okay, very cool. Awesome. That you mentioned kombucha. I am such a lightweight that kombucha makes me drunk. It has a, you know, it's like once it's fermented, it's just a tiny bit. Yeah, it's like I get a little, yeah.
I'm brewing some right now. I'll bring some for you.
Oh, I don't know. All right, we're gonna go on to our next thing. 1 second here. Remind myself what our next topic is, but this is fun. And feel free to send us some more questions because as I said, we've got several different things that we're going through, but oh, this is kind of a fun one. So you know, I've heard so many people say they've just given up on, you know, shaving their arms and their legs because who cares? But you know, if you're kind of feeling, you know, sweaty and hairy and you know, there are solutions to that. You know, obviously, you know, some people do waxing if they're not into shaving. And of course, we do lots and lots of laser hair removal here. And so our lasers are fine-tuned and ready to take care of you if you want to have a cleaner bikini line and underarms. I think that's been one of my favorite things is not having to worry about shaving my underarms anymore. And that's been great. And then, you know, one other thing, actually a couple different things in terms of both sweat and hair. There's a system called MiraDry, which is actually, it's a very busy machine around here. We're actually like in the top 10 in the entire country for MiraDry. And basically it's a system where we numb up your underarms, and then it's a device that heats up the tissue. It cools the skin so there's no skin breakdown, but it heats up the deeper tissue so it ablates the sweat glands. And at the same time, it also ablates the hair follicles. So it's kind of a neat combination of decreasing sweat, getting rid of underarm hair. And the other thing is odor. That's been a concern for a lot of people, and definitely one of the very positive benefits of of Mirror Dry is that, you know, there's a difference between stress sweat and, workout sweat. And workout sweat doesn't really stink, but stress sweat really smells. And so by doing this, you really take care of both the kind of more oily and less abundant stress sweat that has the strong odor, as well as some of the workout sweat. Obviously you're going to sweat other parts of your body, but sometimes people, like, they constantly have a wet ring underneath their arms with any type of clothing that they wear, so they have to change clothing really frequently. So Mirror Dry has been super awesome. If you're mostly just worried about sweating, Botox is also a great option for you. It's been there are some insurance companies that do cover Botox for sweating, and if you meet certain criteria. So we can kind of talk through that. And I know, Tanya, I'll have you mention a little extra about facial hair, because that, if you have excess facial hair, there's some other things we should consider. So go for it, Dr. Tanya.
Yeah, and I just wanted to mention, did you see there's a question here too from one of our participants, if you want to talk about it, or I sure can. But so I get a lot of women who come in who, we do a lot of hormone work, or I try to, I see a lot of patients for hormone concerns, whether that's like, hey, my hair is falling out and it needs to stop, because, what I always tell my patients is I would be a very unattractive bald woman. But everybody seems to be worried about the hair, right? Like, is it on my head, or if it's somewhere else that I don't want it, can we get rid of it? Yes, we absolutely can. However, I also really wonder about why, right? Women aren't necessarily supposed to grow beards and mustaches and, really thick, say, arm hair, for example. And so that's often some hormonal dysregulation that we can find out really easily through some of that urine and saliva testing that we talked about, which then gives us the opportunity to say, okay, how do we balance your hormones, whether that's through prescription or herbs or supplementation. But I think also getting to the root of it, right? Like, you might grow back, or if Mirror Dry didn't work, which I can't wait to try it, by the way.
Right.
But if we have hair, let's figure out why it's there, because sometimes there's a hormonal component. Sometimes it's actually just your ethnicity, right? Like, my mom was really hairy, I'm really hairy, for example, or something. But if not, then let's see if it's a hormonal dysregulation so that we can fix it.
Mm-hmm. Great. Yeah, and that goes along with hair loss too. Sometimes there's a hormonal reason for hair loss, and we can work on that by balancing hormones, as well as using things like PRP to stimulate new hair growth. We had one question about, aren't you supposed to sweat out the toxins? And I think this is about, yes, when you're working out, obviously you sweat from, multiple different places. And, if you're working out or in a sauna, you're going to sweat out what needs to be sweat out. We're kind of talking about, inconvenient places to sweat, like especially underarms, because that, because of the type of sweat glands there, it tends to be, more problematic in terms of odor, and also, clothing and staining. And so, yeah, this isn't going to take away your ability to sweat naturally. But when sweat kind of, is, problematic, they're, especially under the arms, it can be controlled. We can also do, some people have sweaty hands, and I do have several patients for whom we use Botox in their hands to minimize that. I have a young lady who is, a financial planner, and I think I've been seeing her for 10 years because, with her business, she would drip sweat from her hands onto her paperwork. Back in the days when we used to shake people's hands, that was a problem too. I think we're gonna just be doing this, or a fist bump from now on. But anyway, it's like we can manage. there are some people who also get really bad sweating on their feet, but it's just too uncomfortable to, the skin is so thick there, you'd have to use such a big needle. So I steer clear of that. I have sent a few patients to Mayo Clinic also for a special procedure that can help. They actually ablate a nerve. And I know of a few surgeons who've had to have this done because they would sweat so badly in their gloves that they would get rashes inside their gloves when they did surgery. So the other thing is some people, like especially after if they have surgery for this is where your parotid gland lives. And so sometimes if we need to take out your parotid gland for a tumor, the little nerves that used to innervate the salivary gland and help you, stimulate your saliva when you chewed food. Well, whenever they would eat, those little nerves would innervate the sweat glands of their skin after the disruption of surgery. So I've actually done Botox for people's faces if they have that condition. And sometimes people who have really bad sweating of their head too, where they drip sweat when they're trying to work. So kind of interesting stuff. Remember the days of tennis players when they used to wear those terry cloth bands across their foreheads to catch the sweat? Well, most of them get Botox in their foreheads so they don't drip sweat into their eyes. But then, as I said, I've had a couple of nurses who've come in and we've done Botox in their foreheads and their scalps so they wouldn't drip onto their patients. So kind of some interesting stuff. Now we will go on to the next topic. And thank you again to Carissa for getting all this set up. So, another thing we've been talking about during, our coronavirus quarantine is, energy levels. I think that we've definitely been, through this has been, a global trauma. And so, it's okay if you're not motivated to clean your entire house and have it be, condo organized. And, it's like, I think there's a lot of people are putting a lot of pressure on themselves to, kind of be, perfect. It's like all this time, what are we going to do with it? The endless projects. And so, it's okay to do some things that you feel nurturing, but you don't have to put yourself, under, high pressure to accomplish everything on your to-do list. So, I'm going to have Dr. Tanya jump in and we'll go back to our picture screen so we can see her talk. But, just about, what kind of things we look into when we talk about energy levels.
Yeah, I know we've talked so much about hormones. I kind of feel like we've just talked about it all, but the other thing that I, often see is that thyroid hormone being a really big factor in, people's energy, also in their hair, of course. So thyroid levels are really important. I always tell my patients that thyroid is like it's the gas pedal pusher, right? Your cells can work, but if there's no gas getting to them, they're not going to turn over and they're not going to make energy like they need to. So we need to check those levels. And this is where my, naturopathic training comes in, I think. And we're actually going to dive a little bit deeper than just testing the hormone that comes from the brain. We're actually going to test the levels that are present in your body of actual thyroid hormone. And we're going to figure out why your thyroid's not working if it isn't working, right? So is it autoimmune process or is it something else that's going on? Maybe it's a nutrient deficiency. So thyroid is always on kind of the top of my list of why people are feeling fatigued and sluggish. The other thing I think about is cortisol. And I think this one gets missed a lot. I don't have a lot of patients coming in telling me that, oh, I've had my cortisol tested many times, it's fine. We actually do a saliva cortisol here and we test it throughout the day. So we test it about 5 times throughout the day. And it tells us how well your adrenal glands, or those little caps that sit on top of your kidneys, are functioning and handling stress. And Dr. Sue talked a little bit about, your melatonin at night. Cortisol is its kind of daytime sister. And what it does is it increases in the morning to get you out of bed, right? So that'd be my first sign that maybe your cortisol is a little bit off. It also goes down at night so that you can go to bed. And a lot of patients come in and they say, gosh, my brain is racing. And I go, oh, you have a hamster wheel. Your hamster is on your wheel and it's all night and it's go, 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 go. That's cortisol. So that inability to turn your brain off and just you shut your brain off at night to go to sleep, that's cortisol dysfunction. And that might also cause some daytime energy and fatigue and sluggishness. So really making sure that we know what's going on with our cortisol is a huge piece of that. There was a question that ties into this too, so I'll answer it here. And it was, what about brain fog? And I think brain fog goes really nicely with energy, because brain fog is maybe not only a cortisol problem, but potentially another hormone problem, right? A hormone dysregulation, because if you're not sleeping well, you can't remember what you did yesterday, and now your cortisol's high. Cortisol is that hormone that gets released when you're running from a tiger. Well, guess what? We don't run from tigers anymore. We actually run from, bosses and children and deadlines and, all of the kind of stressful things that we do during the day. And right now we're probably running from COVID. And so those are the things that are going to spike that cortisol. They're going to cause some brain fog. They're going to cause memory, word finding issues. And that's kind of my next clue into, oh, you maybe have some hormone dysregulation of your cortisol. Other energy pieces can really tie into testosterone, and low testosterone can often in women can really be a sign of fatigue. And so that's why it's important not to just to look at estrogen or not to just to look at progesterone on itself. We want to look at that whole big picture for you so that we know that we're not missing a piece of the puzzle, because they are so intricate and they don't play by themselves, right? We're all in the sandbox together here.
Good. Yeah. And, all these hormone levels, definitely impact sexual energy, as well as just, that get it done energy during the day. And so we're going to talk a little bit more about, the lower regions now. And so I'm going to have Chris kind of go to our next slide. And there. So we're going to talk about, as I mentioned, sexual energy, but it all kind of goes along, it's like when, and, things are not working. So we talk about leaky bladder syndrome. For those of you who had kids at home, it's, maybe you've been playing outside a little bit more. Maybe you've been wanting to jump on the trampoline, but maybe you're worried that something tragic might happen and you're gonna, wet your pants in front of others. And so I figured we'd talk a little bit about that, and we'll go back to our shared screen again. Because there are solutions, there are definitely, hormonal impacts with our bladder function, our muscle tone, etc. Tanya has some special expertise with some pelvic floor therapy, and then we have a few kind of, really cutting edge, innovative treatments to offer here. So go for it, Tanya. Talk a little bit about pelvic floor, etc. So.
Yeah, so I love when you talk about the trampoline, because we live in a neighborhood and everybody's putting up their trampoline, and I'm like, all of the moms are wearing black leggings.
Yeah. Mm-hmm.
And I'm like, oh, I should put my cart over there. That might be a little invasive, but that's the comments I got the first time was, I have to wear my black leggings to Orange Theory because I'm afraid I'm going to pee my pants and everybody will know. And that hasn't been the first time I've heard that. I keep hearing it. So now it's just this running joke of, do you have to wear black leggings? And if you do, maybe you should come see us. But so hormones play a lot into that, because as estrogen decreases, right, that vaginal tissue kind of turns into tissue paper, right? And when that happens, things tear, they don't feel comfortable, sex is painful, things get dry. But that also impacts our bladder, because if we remember right, the urethra, the vagina, and the rectum are really, really close. And they all kind of share that same area. So keeping that vaginal health is really important. And that pelvic floor, we don't often think about it, right? It's really just there, and most people probably don't even know that they have a pelvic floor unless they've had issues. Those muscles do a really great job at keeping the bladder in place, keeping the uterus in place, and making sure that the rectum is also doing what it needs to do. And the best way really to get to those vaginal muscles, or those muscles, is through the vagina. So I'm trained to do holistic pelvic therapy, and we do that with patients to kind of help that incontinence, to help that dryness. Sometimes it helps with libido, sometimes it helps with, crampy, icky periods. And so that's maybe the first step, right? Like, come in, get an evaluation, let's see what's going on. And
Mhm.
Dr. Sue mentioned a couple other things that are available here at Catalyst. One of them is Emsella. And that Emsella is really all about strengthening those pelvic floor muscles, right? So maybe you've had a baby, maybe you haven't had a baby, but you've had some trauma in the area or you've had surgery. Those pelvic floor muscles might need to be strengthened. And that strengthening of those pelvic floor muscles can be done through that Emsella chair. And what it is, it's like doing Kegels without having to do Kegels, which is so cool. Because Kegels sometimes can be done wrong. You maybe aren't getting them enough during the day because you forget about it. You can come in, you can sit on the chair, and it'll actually kind of help your body do those Kegels and help strengthen those muscles for you, which, I mean, that's so cool that we have technology to do that.
Mhm.
And the other thing is Vivive. And I think Vivive is like kind of the cat's meow of pelvic floor stuff, because what it does is it actually changes the tissue of the vagina. So it's actually making that tissue stronger by increasing its collagen. So we all know that collagen helps with wrinkles and, things like that in our face. We don't ever think about like vagina wrinkles, right? But that's what it's doing, is it's making it stronger. It's making it less like tissue paper, and it actually just kind of creates a better structure for the vagina, for the bladder, for the uterus.
Mhm.
It also is helpful for like feeling, right? So as we age, sometimes sexual function and pleasure decreases. It actually helps with that as well. And so kind of, it's almost like a twofer, right? You get pelvic floor therapy, plus you get increased sensation, increased blood flow to the area. And those, that kind of triage of, that three, system together would be really, really awesome for someone to kind of take care of all of those bladder issues.
Cool. Yeah. So that, it's Emsella is the kind of the pelvic floor version of Emsculpt, which we have as well. And it's very great for toning abdomen, butt, thighs, and arms. And so, we have compared it to all the other systems, and we know that Emsculpt is the best system, and science has proved it. And so, Emsella is basically, it's from the same company, but it tightens up those muscles of the pelvic floor. Actually, and men can use it too, so it can be helpful for erectile dysfunction. So lots of great things. We also do the O-shot, which is using your own rich plasma, and we inject it into the clitoris and into the vaginal wall. So it works really well with all these systems. So it's kind of like, basically an integrated approach to, helping you feel better, head to toe, shall we say. So pretty great stuff. And once again, we just hope that, some of the info that we've shared here will help you get your groove back. And, Catalyst is celebrating its 20th year, this is 2020. And so we continue to bring you new providers like Dr. Tanya, and new treatments. I'm a scientist, I'm a physician. I'm very, very proud that this is a physician-owned and run organization. I appreciate all of you helping to support our healthcare workers, and I'm in the trenches, not only at the hospital, but here at my clinic. And so we appreciate your supporting us here at our practice too, because we, definitely love and support our patients. So I think we just have one more slide to go to. Make sure I didn't forget anything. Yeah, this has kind of been my motto through, through these times, and I think it's, they're kind of good words to live by. Stay strong, stay safe, stay healthy, and stay kind. Stress brings out the best in some and the worst in others. we never know what story, the story behind people's behavior. So be patient. If they're annoying you on Facebook, um, maybe you can hide them for a little while, but um, there's a lot of people going through a lot of hard things. If you have the means to contribute to food banks and homeless shelters, I encourage you to do so. We've definitely done that through Catalyst as well.